two examples of a more in-depth look of what the hemoglobin cells look like. So it's just to kind of give you a visual of what a normal hemoglobin cell looks like versus how the process of what sickle cell anemia and how it kind of develops.
So red blood cell.
Sorry, red blood cell. So with the red blood cell, it's this oval shaped, flexible, non-rigid cell that is full of oxygen molecules that oxygenates the blood. But when you have a sickle cell, what happens is when that red blood cell becomes deoxygenated, it causes it to form this sickle shape. And what happens, the sickle shape is very rigid and is inflexible. So when it starts to flow through the blood vessels, as you can see, if you can imagine with the red blood cells here, they are flexible, they're bending. So as they're flowing through the blood vessels, they are easily flowing through because they bend and curve and shape however it needs to get through the blood cells. But with the sickled ones down here, the sickled ones, they're more rigid. So when it comes to bending and turning and trying to flex along with the vessel, they tend to start to clump up and they get stuck, and you run into the issue of clumping, and now blood is having a hard time flowing through the vessel, which leads to other issues. So some of the things that could cause sickling, you have many different things that could cause sickling to begin. So any condition that's going to increase the body's need for oxygen. So that could mean anything from having a fever to emotional stress. Can also lead to the body needing more oxygen. And then high altitudes, not a properly pressurized airplane. These are all things that can lead to the body's need for oxygen. Overexertion, where it requires a demand for more oxygen. This can also lead to the body needing more oxygen. So someone who has sickle cell or has a sickle cell trait even sometimes can exacerbate into a sickle cell crisis.
Extreme temperatures, like extreme cold, things like that.
Also, yep, extreme cold is also one of the other main ones that can cause sickling as well. But also the sickle cell can actually revert back to its old shape. That's why you have these intermittent crises. So if you happen to catch it before it becomes too rigid, then it can actually return back to its normal shape. So when we get to talking about interventions in treating someone with sickle cell, you'll be able to understand like the importance of getting them hydrated, getting them oxygen, using those as interventions, because it can also help the red blood cell return back to its normal shape. So also when we're talking about red blood cells, the normal life of a red blood cell is about 120 days for that red blood cell to be reproduced. So every 120 days, you have red blood cells that are being reproduced. But with the sickle cells, that lifespan is much shorter. It's 10 to 20 days. So imagine if these are dying off every 10 to 20 days, and now our bone marrow is trying to work overtime to replace these sickled cells that are dying off in 10 to 20 days instead of the normal 120 days, it's going to put the bone marrow into overdrive trying to keep up. And this generally just starts a chain reaction to, leading to other things, because if the bone marrow is having to overwork, it's going to cause things like bone swelling, or the bone marrow may completely shut down and not produce anything because it's being overworked trying to replace these sickle cells, because they die off so quickly. Any questions about that? All right. So we're going to get into talking about the pathophysiology and etiology of sickle cell. So when the red blood cell that contains the hemoglobin S, which is the sickle cell, passes through the vessels, the deoxygenated hemoglobin causes the red blood cells to become rigid and deformed, like we talked about a little earlier. So what that does is when it does that, it causes the sickling. So it causes the cell to take the shape of a sickle. And that process of that deformation of the cell is actually called sickling. So it starts to go through that process. And then, as I showed you earlier on the previous screen, once it started to take that sickled shape, it becomes deformed, it becomes rigid. Once it goes through the blood, it goes through the blood vessels, it starts causing what we call vasoocclusion. And that vasoocclusion is basically a blockage that has been formed from the clumping of the cells that has gotten stuck, against the epithelial walls of the vessels, and now the blood flow can't pass through properly, which leads to, extreme pain and things like that. So, some individuals with sickle cell, as I stated before, the bone marrow is constantly trying to reproduce more red blood cells because these are dying off so quickly. And so that can lead to something else called an aplastic crisis, which we'll talk about in a little bit as well. So how do we get sickle cell? People, that's always a question. If someone is diagnosed with the disease, they want to know how do I get it? And plus you want to know, the history of sickle cell. You want to be knowledgeable about it, because if you have someone that is considering, having children, and they may have sickle cell, or they may have a sickle cell trait, or they have done some genetic counseling, you want to be able to educate them properly on, the risk of also having a child who has sickle cell. So just a little background is what we call an autosomal recessive gene. So basically it takes 2 copies of the trait or the gene in order to have a child who will have the sickle cell. So that's what autosomal recessive means. About 1 in 500 African Americans do have the sickle cell disease, and then 1 in 12 have the trait. So it's really high in the African American population, but as you can see, there are a lot of different ethnicities that are predisposed to the disease as well. So African American is the highest, but you also have a high concentration in Central Africa, the Near East, Mediterranean, over in India, Hispanics that are from the Caribbean, and our Central and South American countries as well.
Can I clarify something?
Yes.
Just when she's saying it takes 2, that means you have to inherit a gene from each parent. So in order to have the actual disease, if you inherit one S mutation, you will just have the trait. But if you have to inherit the S mutation from each parent in order to have the actual disease process, sickle cell.
So to kind of piggyback off what she was saying, if both parents happen to have the trait, then there's a 25% chance that each offspring will actually have the sickle cell disease. Okay? Any questions? Oh, just to mention a little bit also about, the differences. There are women and men both have about the same prevalence of developing sickle cell. So it's not like it's, more prevalent in men or women, but men tend to get sicker with the sickle cell disease. And one of the reasons that they may think that might be possible is because women have a high level of what they call nitric oxide, and nitric, not nitrous, which is the laughing gas, so not to be confused. They have high levels of nitric oxide, which nitric oxide helps to relax the smooth muscles and relax the vessels. So that way, if there was a sickle cell, you may not have as much clumping because of the relaxed blood vessels and things like that. And women tend to have a higher level of those than men. And I think that possibly may have something to do with estrogen and the part that estrogen plays on the synthesis of nitric oxide. But they're both equally, prevalent to getting the disease, but men tend to be a little more sicker. when they do have the disease. All right, so these are 3 types of sickle cell crises. So I mentioned, sickle cell anemia as one thing, but we have 3 types of sickle cell crisis that we have here. And I will go into more detail as we go, down the list. So sickle cell disease, the sickle cell trait is the most benign. So if someone has a sickle cell trait, they have, less likely chances to have complications from a sickle cell crisis, but it is possible. It's not, it is possible for them, especially in situations where, dehydration or extreme temperatures. Someone with the trait can also go into crisis as well when you come to those things. So let's just, with dehydration, why do you think someone who has a sickle cell trait might be more prone to have a crisis if they get dehydrated? What do you think about with dehydration?
Viscosity of the blood vessels decrease, so then the sickles can't get through it, so they just clump up.
Right, so, with dehydration, your blood volume is gonna be low, right? So the fluid and the blood volume in your body is gonna be lower. So that will increase your chances of the sickle cells clumping versus someone who is well hydrated.
Blood will be more viscous.
The blood will be more viscous. I didn't want to use the word viscous because I was like, then you'd be like, viscous means.
Thicker, it'll be thicker.
All right. What is viscous? Yes, viscous. The viscosity of the blood will be much thicker, which could cause, the clumping, increase the chances of the sickle cells become clumped. So, also another organ that is highly affected with a sickle cell crisis, which when we talk about the sequestrian crisis, that's the spleen. The spleen is one of the organs that can be affected. Generally, you see this in children. And then in the adults, the organ that's most likely to be affected are the lungs. So children, the spleen; with adults, are the lungs. So let's talk about these 3 different crises for a second. So we have our acute vaso-occlusive crisis. So this one is the one that causes all of the pain. So when you have your sickle cell patients, they come into the hospital in a crisis and they're having a lot of pain. This is probably the crisis that they're experiencing. And so with that, you have the entrapment of the red blood cells and the white blood cells, which is causing the tissue hypoxia, which is the decrease of oxygen. It's causing inflammation, which is the swelling, and then necrosis or the dying of the tissues due to inadequate blood flow. So all of that is going on during this acute vaso-occlusive crisis. So that's mainly the one with the pictures that was depicted with the clumping, all that. That's mainly the one that they're experiencing with that. And so that comes with a lot of pain. So, of course, any activity that is going to boost, the oxygen levels can help with this. So that's why we use oxygen. That's why we use IV fluids to treat this, because the increased oxygen levels will help to relieve, this pain. So some of the things that, question.
Where are they having the pain at?
It can be anywhere. Yeah, it can be anywhere, but leg pain is usually one of the things that complain of. Abdominal pain.
Wherever it's clumping at that?
Yes.
Yes. Mm-hmm.
Yeah.
Yes.
So abdominal pain, extremity pain, this is what back pain, that's what we see a lot of times. You got the spleen, you got the liver, all of that in the abdomen. So a lot of times they'll get abdominal pain, and then the vessels in the legs get occluded, so they complain of extremity pain a lot of times too. So it can vary though.
Yeah. But like she said, the most common ones are extremity, stomach, back, things like that. Yes, sir.
Is it mostly due to edema? Is the pain?
No, it's from these things.
Oh, just
the necrosis,
hypoxia.
the tissue, yeah.
Okay.
The hypoxia.
So, the hypoxia, the inflammation, and then the dying of the tissue because the blood flow every tissue, every organ, every bone has to get proper blood flow.
Right.
And if it does not, then it starts to die off, and that causes pain as well. Yep. Yes.
For adults, you said it's the lungs that get infected?
So that's the organ that's most infected in adults.
So what kind of symptoms do you see there? Would it be chest pain?
They
Yeah.
may complain of chest pain. Yep. They may complain of chest pain, shortness of breath.
We'll get into a lot of the complications. I don't know if you're covering that part or if
No.
I'm covering that part. But acute chest syndrome is a thing that we see in a lot of patients with sickle cell. So we'll talk about that a little bit and the signs and
And pulmonary
symptoms that's
hypertension.
associated. And pulmonary hypertension, which is, so we'll talk about that in a little bit later too.
Did you have a question?
Because earlier, I know you were talking about the sequestration with the spleen and saying that was kids, and then you said adults' lungs. Is that any type of sickle cell, or is that specifically the sequestration?
With
Sorry,
the
I'm
spleen?
confusing myself. Yeah,
The spleen is specifically the sequestrian.
and then the adults' lungs is all of them?
Well, spleen can be damaged anytime. I
Okay.
mean, children have sickle cell, people have sickle cell from birth. So it depends on how many crises they go through and that kind of thing as to whether they will have spleen damage or even liver damage, because the liver processes a lot of the blood, so those sickled cells can get clumped up in the liver, can get clumped up in the spleen. So it depends on the number of crises they may have as to whether the amount of liver or spleen or damage or any organ damage that they may have. It just so happens the spleen, the liver, the lungs are the most common organs that are affected, and the heart even, are the most common organs that are affected by sickle cell.
So it's just sequestering if other organs are affected?
It's just sequestration crisis, are you referring to? She hasn't gotten to that yet. We see that in children 5 or younger, basically, the sequestration crisis, when
you
it's
won't see
called that.